All right, so inferior glide is one of the important ranges of motion that we need to consider, at least with impingement syndrome and rotator cuff syndrome, but also in these cases with the biceps tendinopathy, just because they could have a little bit of instability there, causing that glenohumeral joint to rise up as they go through any kind of abduction. What you're going to do, I'm just going to move this to the side, is find that acromion right here. And he's a big guy, you know, he's got a lot of muscles around the shoulder, so I'm going to need a little bit more force with him than with someone else. So I'm going to use a little bit of my body when I do this. So I'm going to have his arm out to the side, and it's nice and relaxed. Now, when we talk about doing any kind of mobilization of the joint, you absolutely want to make sure it's safe and it's easy on the patient. So when you're doing the shoulder, you want to put it in an open, packed position. So when I first started doing this, I had the arm out like this, which isn't bad. However, that means that the shoulder still is not very loose. If you want to be in the open pack position, it would look more like this. So he's nice and relaxed here. I'm holding his arm. He's not using any muscles, especially those postural muscles. I'm just going to slide just distal off that acromion. And for those of you who can't see, my arm is attached to my hip. So when I get in here, I'm just going to use my body weight. I don't have enough force. I'm not strong enough to provide any kind of inferior glide there. So I'm going to be here, slide just off the acromion, and I'm just going to push down and back. And it's just a very short, I'm not thrusting or anything. It's just a very simple mobilization. I can do 3 sets of 10 to 12, and I can also move the arm into more flexion and abduction. And he could probably tell you he can feel his humeral head glide on that glenoid. Was that painful at all? A little tingly. So we can also do from the same position. The number one range of motion loss is going to be internal rotation. So I'm just going to have his hand support, or his elbow supported here, and just let his arm drop into whatever internal rotation he can go. That's about it. Probably not very comfortable there, but it's not causing any kind of pain, no numbness or tingling. And then I'm just going to put my hand here. I'm not going to push my hand down, and I'm going to have him take his hand and push up towards the ceiling with about 10% of his force. He's going to hold it right there for about 7 to 10 seconds, and then relax. And when he relaxes, I'm not going to push down. I'm just going to kind of hold it, vibrate a little bit, and let it drop a little further. Same thing, push up towards the ceiling. He's going to hold, and then relax, and let it drop a little further. Same thing, push up, hold, and drop a little further. And come on up. Let's just see if he can pick his arm up and see how it feels now. Any pain or discomfort with that? Thanks. Thank you very much.
She got a couple adjustments on my thoracic.
There you go. Thanks.